Standing here right in front of the United Nations as the General Assembly meets once again, and now joining us is Jeff Sturchio. He's the president of the Global Health Council. Mr. Sturchio, would you please give us an overview of this event?
Well, today we had an event with the Mission of Botswana to look at integrating across the Millennium Development Goals, and I'll explain that in a moment. This is part of the week-long series of events that's taking place in New York with respect to the UN General Assembly's review of progress against the Millennium Development Goals. It's a set of targets that the world community adopted 10 years ago to try to improve poverty reduction, to improve health conditions around the world, to improve education of children, the environment, and global partnerships for development. So that's the broad context. The Global Health Council organized a side event today to look at how to integrate across the Health Millennium Development Goals so that we can achieve maximum return on the resources invested and the best improvements in health in the three areas that the Millennium Development Goals focus on: child health, maternal health, and HIV/AIDS, TB, malaria, and other infectious diseases.
Sir, what was the actual aim of today's event?
We wanted to look at how important it is to work not in silos to help child health, maternal health, and HIV and AIDS, but to figure out the right way to integrate across those different areas so that you can actually achieve more with the resources available. And we organized this in conjunction with the Mission of Botswana because Botswana is really a terrific example of success with the Millennium Development Goals. They've really been able to show what's possible when you have the right policies in place, the right programs, you have political commitment, you invest the resources and have the right partnerships, and they've made real progress against HIV and AIDS and the other MDGs. And so that's what we wanted to do, was to look at the importance of integration.
This is probably an obvious question, but why does the Global Health Council have a seat at the United Nations Summit?
Yeah, well, health is clearly one of the most important foci of the Millennium Development Goals because there are a number of reasons why. I mean, starting with just the human impact of infectious disease and other health conditions, but also health is wealth. If societies don't have healthy populations, it's difficult to achieve the economic growth that one needs to really end poverty in that country and in regions of the world. So that's why the MDGs focus so much on health. I think what we were able to see in the discussions this morning are some of the ways in detail that Botswana has been able to bring together all of these different threads into one fabric that really has achieved tremendous results in terms of almost eliminating pediatric AIDS, treating 100%, virtually 100% of the people in the country who have HIV and AIDS, and making progress on a number of areas as well.
Now, Mr. Sturchio, let me ask you this. Are you hopeful that you will reach the goals that you have set at 2015?
Well, it's an important question. Often people are only looking at the glass as half empty rather than half full. You'll hear a lot this week in the news about how the world isn't going to achieve the Millennium Development Goals. But what I think is much more important to look at is where we have had success. Botswana is a good example of that. There are other countries as well where, just take Africa, for instance. It's not one country, it's 53 countries. And many of them are making tremendous progress toward achieving the goals. So what's important now, with 5 years to go before the 2015 target, is to really learn from the successes and find ways to scale up those successes elsewhere in the world so that we'll do as good a job as we can of helping everyone to achieve those aspirational targets.
Mr. Sturchio, thank you very much for taking time out of your busy schedule to be with us here today.